I appreciate those efforts. I still think we have a problem if grants are being scanned for the word women and then clawed back or not funded. So I hope you look more broadly, even though
A Republican senator just stood up in the middle of her own party's hearing and told the secretary something nobody expected to hear. What she said next stopped the room. Watch carefully.
I want to welcome the chair of the full committee, the senator from Maine, Senator Collins, and I'm going to ask her to start off the questioning. Thank you.
Thank you very much, Madam Chair. Secretary Kennedy, before I get to my questions, I want to thank you for your efforts in securing the release of the low-income home energy assistance program funding that had been held up and is very important to many of our states. Now, turning to my questions. Yesterday, the Washington Post published a story on NIH grants, which documented a 31% decline in the number of research projects funded in 2025 that included the word women. I brought up this exact issue with the NIH director at a recent hearing before the Help Committee because the administration's emphasis on canceling diversity-related grants has resulted in less research aimed at women's health. It is well established that disparities in women's health exist. For example, the incidence of Alzheimer's disease is higher in women than in men, and it is not explainable by the fact that women live longer than men. There are also disparities within the female population. For example, pregnant women who are Black have a higher maternal morbidity rate than white women, while Asian women have a better outcome than white women. Yet it appears that the administration is looking at these health disparities and is not looking at them, is pulling back from these grants instead of figuring out why these health disparities exist and how to address them. I know that your budget request notes the importance.
VO2. Notice what just happened. He answered a question about Alzheimer's, maternal mortality, Black women dying in childbirth, and responded with program announcements. Not data, not accountability, announcements. The real question Senator Collins is circling around isn't being said out loud. If a grant gets flagged and killed simply because it contains the word women, who decides which women's lives are worth studying? The perinatal pilot program is real, but it cannot replace an entire ecosystem of research being quietly dismantled by a keyword filter. What do you think gets cut next? Drop your answer below.
Of continued investment in maternal health, but how are you going to address other health disparities in women's health, such as the disproportionate burden of autoimmune diseases, Alzheimer's disease, as I've mentioned, if diversity is no longer a criterion in making funding decisions?
Senator, thank you for that question. We're about to announce in the next coming weeks a major program, major investment by ARPA to study Alzheimer's and to focus on new treatments and preventative treatments and ways to reverse Alzheimer's. There are many, many grants at NIH now studying Alzheimer's and diabetes. We're focusing for the first time on chronic disease and its etiology, which has been neglected by that agency for many generations. We're going to identify the causes of chronic disease and how to eliminate the exposures that are generating this giant epidemic. We're focusing on maternal health. And I can read you a whole list of programs that we're doing on maternal health right now. And you're right, we have the worst maternal health outcomes of any of the Western countries, and black women are 2.6 times more likely. A college-educated black woman is 2.5 times more likely to die from maternal health mortality. And a college-educated white woman. One of the programs we have now is the perinatal pilot program, where we've enrolled 220 hospitals in 1 year. We've dropped the rate of maternal mortality by 42%. Nobody's ever done that before. And we're now trying to extend those protocols to all other hospitals.
I appreciate those efforts. I still think we have a problem if grants are being scanned for the word women and then clawed back or not funded. So I hope you look more broadly, even though I support the initiatives that you've mentioned. I do want to move to another issue. As you have heard from the subcommittee chair, there has been strong bipartisan support on this entire committee for the investment in biomedical research. In fact, it's hard to think of an investment that pays greater dividends to American families than that investment, because it leads to life-saving and life-enhancing discoveries. The administration's budget, much to my dismay, once again proposes an arbitrary, one-size-fits-all 15% cap on indirect research costs, despite the fact that Congress blocked an identical proposal last year that originated with OMB. Such a cap would harm cutting-edge research happening at universities and other nonprofit laboratories and medical centers across the country, and undermine the foundation for our nation's global leadership in biomedical research and technological innovation. Mr. Secretary, rather than continue to pursue a policy that Congress clearly rejected, both sides of the aisle, both chambers, will you work with us and the research committee to find a better way to increase transparency and accountability that does not come at the expense of crucial biomedical research?
Absolutely. I look forward to working with you, Senator. I would say this, that nobody in my agency wants to cut any of these agencies, any of these programs. And I don't think Roosevelt wants to cut them either. We have a $39 trillion debt, and all of the agencies across the government have been asked to tighten their belt. In my agency, I've been asked to cut 12%, and all of these cuts are painful. But we are at the cutting edge right now in terms of revolutionizing biomedical research in our country. We're losing our lunch to China. China last year, 50% of the new drugs that were approved were from China. It went from 3% of the clinical trials to 30%, and another 30% are going to Australia. So we're losing our IP, we're losing our best researchers, we're losing our scientists, and we're losing ground in terms of our biosecurity. These are all things that we are focused on. We are compressing the pathways to approval and compressing clinical trials. I think I'm out of time, but I will talk more about that later.
Thank you, Madam Chair.
Senator Baldwin.
VO1. A keyword. That is what this comes down to. Not ideology, not policy. A keyword filter scanning federal grant applications. And if the word women appears, the funding is at risk. A 31% drop in research projects in a single year. Let that land for a second. This is not a fringe accusation from a political opponent. This is a Republican senator, the chair of the full committee, sitting across from a cabinet secretary appointed by her own party's president, telling him directly, "We have a problem." Senator Collins did not come to that hearing to score points. She came with a Washington Post report, a documented percentage, and a specific question that had no clean answer. And what she got in return was a list of programs, some of them genuinely impressive, but none of them actually addressing what she asked. Here is what that exchange reveals that the headline won't tell you. The administration's position is not that women's health doesn't matter. The position, stated or unstated, is that diversity as a category is suspect. That any research framed around disparity, around identity, around demographic difference, is by definition ideologically compromised. Pull the diversity language, pull the funding, and trust that good science will fill the gap. But here is the problem with that logic. The disparity is the science. When black women with college degrees die at 2.5 times the rate of white women with college degrees during childbirth, that gap cannot be explained by poverty. It cannot be explained by access alone. Something else is happening, and the only way to find out what is to study it. That requires grants. That requires the word women. That requires the exact kind of targeted, demographic-specific research that is now being flagged by a filter. This is not a fringe concern. The Alzheimer's disparity Collins cited is textbook epidemiology. Women make up nearly 2/3 of Alzheimer's patients. The gap exists independent of lifespan. That means something biological, hormonal, or environmental is driving it, and we do not fully know what. Research aimed at understanding that gap is not identity politics, it is medicine. But here is what nobody is asking loudly enough. Who built the filter? Who decided which words trigger a review? And is there any appeal process for a grant that gets clawed back? Or does the science simply disappear? Because that is the quiet devastation buried inside a 31% statistic. It is not just funding that gets cut. It is the researchers who lose their positions, the institutions that restructure their programs, the graduate students who shift their dissertation topics because the grants dried up. The pipeline of women's health research doesn't pause when funding stops. It collapses. And rebuilding it takes a decade. Think about what this means if you are a researcher right now, mid-study, and your grant gets pulled because your application contained a word the algorithm flagged. The work stops. The data stops. The patients enrolled in that study are left in limbo. And somewhere in a federal database, a bureaucratic decision made without scientific review has just ended years of work, and possibly delayed treatments that could have saved lives. RFK Jr. is not wrong that America is losing ground to China in biomedical research. That is a real and serious problem. China now accounts for 50% of newly approved drugs. Clinical trial participation has shifted dramatically. The intellectual and scientific edge the United States built over 70 years is genuinely eroding. But the solution to losing ground in a race is not to hobble your own runners. Cutting 12% across the board, capping indirect research costs at 15%, and running grant applications through a keyword filter does not make American science more competitive. It makes it smaller. It makes it more cautious. It makes researchers self-censor their own applications before they even submit, stripping out the language that might get them flagged, even if that language describes exactly what they are studying. That chilling effect is already happening, and no program announcement, however well designed, undoes it. Now, to be fair about what supporters of this approach would argue, they would say the system was bloated, that decades of diversity-focused grant criteria had distorted funding priorities away from pure scientific merit and towards social signaling, that a 15% indirect cost cap forces institutions to justify administrative overhead that had quietly ballooned, that cutting the bureaucratic layer restores resources to actual research, and that the perinatal pilot program, 220 hospitals, 42% reduction in maternal mortality in 1 year, is proof that the new direction works. Those are not nothing arguments. A 42% drop in maternal mortality is extraordinary. If that number holds and scales, it is one of the most significant public health achievements in years. But extraordinary results in one targeted program do not justify dismantling the broader research ecosystem that generates the next generation of targeted programs. You cannot pull up the ladder after you climb it. What both camps are missing is the downstream cost of uncertainty. Biomedical research runs on 5 to 10-year timelines. Grants are multi-year commitments. Institutions make hiring decisions, build facilities, design curricula based on the assumption of stable federal investment. When that investment becomes unstable, when researchers cannot predict whether their grant will survive a keyword review, the entire ecosystem starts making conservative decisions. Fewer risks, smaller questions, safer science. And safer science does not cure Alzheimer's. If this is the analysis you are not finding anywhere else, you already know what to do. The story Senator Collins raised in that hearing is not over. The 31% decline in grants containing the word women is a data point, not a conclusion. The question of what was in those grants, what science was stopped, what questions will go unanswered, that accounting has not been done yet. And when it is done, the number will matter far less than what it represents, a generation of research that was never conducted, and the patients who never benefited from it. This story is not finished, not even close. If you made it this far, subscribe, share this with someone who needs to see it, and drop your take in the comments. What gets cut next?